Hi, Anais. My name is Dr. Mad. I'm going to do your exam today. Can you please verify your date of birth?
06/01/1992.
Okay. Before we begin and start with the medical records to see what we can discover, do you have any allergies to medications?
No.
Okay, that's good. So in case we do prescribe something. Okay. And is there anything in particular that is bothering you today?
I've noticed I do get bruised kind of easily, and lately I've had some trouble concentrating and doing like one thing at a time. I'll start to do something, and then my mind just kind of goes all over the place.
Okay. And for how long have you been noticed bruising?
About a few weeks, maybe like the past 3 weeks.
Okay. And is it generalized or it's in a particular spot?
Very, very like generalized, I think.
Okay. All right. Any pain?
No, not really.
And when you say concentrating, how difficult it is to do your work, for example?
I'd say maybe like it's pretty challenging. I'll start and then I'll listen to something or I get a notification on my phone and then I like forget what I was doing.
Okay. And for how long have you been experiencing this?
I think noticeably like the past couple of months.
Okay. Any recent events that could have triggered this?
Maybe the change of job.
Okay. All right. Any palpitations or difficulty breathing?
Sometimes when I sleep, but not that much.
Okay. I'm going to take your temperature. Have you noticed any flu-like symptoms in the last 48 hours?
I have a little bit of a sinus.
Okay. 98.2. Perfect. I'm going to wrap this around your upper arm here. Okay, do you have hypertension in the family?
No.
Alright. Okay. This is going to feel a little bit cold. I'm going to put it right here under the cuff. All right, no high blood pressure. I'm going to go ahead and slide this down. I'm going to check your pulses now. So I'm going to use 2 fingers and just put them around your wrist. I'm going to have you breathe normal as well. I'm going to go ahead and compare. I want to make sure that your heart functions properly before we do anything else and that we're ruling out something more serious? Very good. So 2 plus there. I'm going to go ahead and take a look inside your ears. I'm not noticing any cerebrospinal fluid. Okay. Get a little bit of redness on this side, but no signs of infection. I'm going to take a look inside your mouth, so we're looking for any swelling. Go ahead and give me a big ow. Go. No swelling, no redness. Can you move your tongue up and down for me? And side to side. Go ahead and give me a big smile. Okay, everything looks symmetric. Go ahead and frown with your eyebrows. Good. And try to lift your eyebrows up. Very good. Now I'm going to try to move your head towards the right side. Don't let me do that, okay? Good. And the same thing on the other side. Don't let me do that. Perfect. I'm going to put my hands on your shoulders as well. I'm going to have you shrug your shoulders. Very good. And now go ahead and extend your arms for me. I'm going to try to press them down. Don't let me do that. Good. Good. Now go ahead and squeeze my fingers. Okay. Very good. Strong and symmetric there. I'm going to check your reflexes. So as you can tell, we're doing also a cranial nerve exam. I want to make sure that all 12 nerves are intact. Okay, I'm going to have you relax your arm. Good. Good. Perfect. So I'm not noticing any sluggishness, impaired sensory stimulation. Okay. Okay, go ahead and relax your arm again. Perfect. Good. I'm going to check your patellar reflexes now. Good. Okay, perfect. All right. Okay. Now we're going to do olfactory nerve. Are you comfortable?
Yes.
Perfect. On a scale of 0 to 10, how would you rate your pain right now?
Oh, like a 6.
6. Okay. So I'm going to be looking for bruising as well around the scalp area and face. going to listen to your heart first. Okay. Palpating sinuses. Supplemental lymph nodes. Non-palpable. Okay, I'm going to check you for a color deficiency. I'm going to ask you to open your eyes. Perfect. And can you please tell me what color you see here?
Green.
And what about here?
Purple.
And
Pink. Blue. Yellow.
I'm going to ask you to keep your eyes open just for another minute, and then I'll have you close them again so that you can fully relax. I'm going to show you a few pictures. Just try to interpret them on your own.
A spaceship.
Okay.
Scarf. Teeth. Peanut. An eye. Hockey stick and puck. Leaf.
Okay. So this is more to assess for ADHD and to see exactly how your brain perceives different realities. Now here I have a few pictures, and these are real people, so if you can please describe in just a few words what you see.
Family jumping.
Okay.
People brushing their teeth. Kids running. A girl whispering to her dad. Friends talking. dad playing with his baby.
Okay. Alright, I'm gonna have you close your eyes now. Going to test your sense of taste. I'm going to put a piece of paper on the tip of your tongue. Go in and open. And I'm going to have you identify, close, and open again. What it tastes like.
Perfume.
Okay. I have here a few more. Okay. Now I'm going to put it on the right side of your tongue. Go ahead and close. What does that taste like?
I don't know.
Okay. I'm going to place this on the left side of your tongue. I'm just going to use two. Okay, go ahead and open it for me. And close. What does that taste like?
Like citrus.
Okay. Alright, this is the last one, I promise. Okay, go ahead and open. Close. And what does that taste like?
Better.
Okay. I'm going to go ahead and check patency of the nares. So I'm going to cover one on the right side. Go ahead and try to breathe in, breathe out through your nose. Good. And we'll do the same thing on the other side. Breathe in, breathe out. Good. Okay. Now I'm going to give you a few smells. So first I'm going to have you describe it in one word and then try to identify what it smells like. Can you do that for me?
Yes.
Okay.
It's like an herb.
Okay, let's try one more. So try to describe it in one word and then to pinpoint to what it smells like.
Flowers.
And how would you describe it?
Soft. Refreshing.
And are you able to pinpoint to what it could be?
Like lemongrass.
Okay.
Strong.
And does it
Garlic.
garlic? Okay. and for any pulsations, changes in movement. Looking for any abnormal growths. I'm not seeing any redness. Good circulation. Good. Okay. Go ahead and tell me if you feel this on the left or right.
Right. Left. Right.
Go ahead and tell me if you feel this equally on both sides.
Yes. Yes. Yes.
Okay. Going to take a look at your scalp now. Taking a look at the scalp, just want to see if I notice any type of bruising. Noticing a little bit of the crown. It does seem like there is a hemangioma. Doesn't seem to extend too much. I'm going to do a few tests here to check for any sensory deficit. Go ahead and tell me how many times you feel this tap.
2, 1, 3, 3, 2, 1.
Okay, go ahead and tell me if you feel this cold or warm.
Cold. 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 Cold.
Okay. And tell me if you feel this sharp or dull.
Dull. Sharp. Sharp.
Does this feel sharp all the way?
Yes.
Okay, do you feel this on the left or right of your hair parting?
Left. Right. Left. Right.
Okay. Go ahead and turn your head a little bit towards the right. Perfect. Any pain as I'm pressing down here?
No.
Okay. Okay. I'm going to go ahead and examine your back now. Okay, nice. I'm going to go ahead and first listen to your long sounds on the back. I'm going to start by palpating your cervical spine. Looking for discolorations, bruising, petechiae, which could be described as pinpoint small red dots. We're looking for inflammation around the spine. Noticing some redness. It could indicate a lack of oxygenation in the thoracic area. It definitely slows down as we're moving downwards. Looking for any fluid buildup. Taking measurements to check for asymmetry. Going to apply electrodes around the bony prominences, and around them I'm going to do sensory tests to see exactly how well your spine responds to certain stimuli. Okay. Go ahead and tell me if you feel this on the left or right of your spine.
Right. Left. Right. Left.
Okay. Do you feel that on the left or right?
The right. Right.
I'm going to apply a sensory gel. So I'm starting first with the right side. Go ahead and tell me, what shape do you think I'm drawing? Good. What about now? Good. I'm just going to make it a little bit more difficult. And it's okay if you don't get it right. What about now? Okay. So this is an oval. The last one. It's a rectangle. Okay. No worries. I'm gonna go ahead and wipe that. Okay. And I'll do the same thing on the left side. Go ahead and tell me what letter I'm drawing. Say that again. B. Okay. What about now? Perfect. Okay. And what about now? So again. One. Okay, now. Okay. And the last one. This one is a little bit more difficult. Okay. Alright. I'm gonna have you stand up and we're going to talk about the treatment plan and what we can do today. Alright, Anais. You did exhibit some of the symptoms of ADHD. So I would say that I want to refer you to a psychiatrist so that they can do a proper evaluation, since I'm a family practitioner and I don't want to mingle and cause any issues. So I want to make sure that you get the proper diagnosis for that. In the meanwhile, we can definitely prescribe a medication that is non-stimulant so that it does help you with your concentration level until you get that referral for psychiatry, okay? Okay. And if you have any questions, just let us know. With the bruising, I did notice a few, but I'm not too worried. And I'm going to go ahead and just do a lab work. We'll see how that looks and go from there.
Okay, thank you.
You're welcome. All right. Do you have any questions for me before I step out?
No, thanks.
All right. It was very nice to meet you.
Nice to meet you also.